Our next guest is really a pioneer, a leader in the field of digital health as it applies to mental health, and such an important and too often underserved field. So Dr. Anmol Madan is CEO of Ginger.io. And Dr. Madan, it's good to have you with us today.
This is exciting.
Well, good. Doug and I and Jonathan were having quite a bit of conversation ahead of the start of this show about what you're doing and its importance. But let's start with the basics if we can. Give us a sense for just the origin of your company and the name as well. I understand there's an association with MIT Media Lab, the sort of fabled digital media experts, Nicholas Negroponte, et cetera. Give us some background.
That's correct. You're right. So Ginger.io is a spin-off of the work I was doing for my PhD thesis at the MIT Media Lab with my advisor, Sandy Pentland, one of the 20 most cited computer scientists in the world. And for the last decade or so, we've been working on modeling human behavior using a sort of explosion in sensors and mobile phones and all this that has occurred. And so really coming from the world of computer science and machine learning, it turns out your phone is this incredible diary that can really understand, this automated diary that understands what's going on in your life. And so designing those technologies in the last few years now, applying those to mental health, where there's just a massive, massive opportunity to help people get better. So that's the origin. And then my co-founder, Karan, as well, was at MIT, and that's where we met as well. So.
Doctor, this is Doug Field, and we really respect and appreciate you joining us today. Talk a little bit about why mental health really has not, I mean, it's a big issue across this country, but it has not really received the amount of attention it deserved until now. Talk a little bit about that, if you would, please.
Yeah, I think you're absolutely right, and I think there's many layers to that problem of us not talking about mental health. I think there's one layer which is really from a stigma perspective, right? And until a few years ago, it wasn't something that was actually a popular conversation in the media. I think even today there's there's just lack of awareness. I think a lot of people don't necessarily understand what a person's going through when they're experiencing an episode of depression or any of the other mental health conditions, and so I think that just getting society to recognize and understand that is the first layer. I think at a system level, in sort of a healthcare system level, really the challenge is massively underdiagnosed, massively undersupported. Most healthcare systems that we work with are really struggling with the access problem. So there's about 60 million people in the U.S. with various forms of mental health conditions, and a small percentage of those people are probably seeing a provider or getting help on a regular basis. And obviously, from a system perspective, a large percent of people with diabetes and heart disease and other conditions also have mental health comorbidities, and they have a much higher risk of readmissions and all sorts of other bad things happening, which we could potentially avoid if we were getting people support at the right time, at the right pace. And a lot of this today has been solved using labor, right? So it's really been about let's staff up on more people, whether it's therapists or nurses or psychiatrists, and labor can only scale so far. I think what we're seeing is there's just a tremendous opportunity in mental health, in behavioral health, for digital solutions, for technologies to come in and take over a lot of the lower layers, the plumbing in some ways that needs to happen to make the system more efficient.
Doctor, this is Andrew again. Can you share with us a bit more about what your product is and what's how does it work? Let's start there.
Yeah. So Ginger.io is a digital platform, a digital solution for mental health. Our goal is to help patients and consumers get help at the right time. We do a lot of this today directly working with the healthcare system, and so it might be a healthcare provider, it might be somebody else in the healthcare system who reaches out to you when our system detects you need help. We're deployed at across the country and everywhere from Massachusetts, California to Tennessee, Indiana, Utah, and working with a variety of different healthcare systems, usually risk-bearing systems. So these are peer providers, and it's a system that actually are affected sort of by that risk and want to solve that problem. And the way the technology works is you essentially, as a consumer, you install this application on your phone. And with your permission, the application starts to understand how you behave. So it turns out our phones are packed with sensors. So we can tell how people move and how people interact with others, and are they get how much approximations of how much sleep they're getting at night. Because when you unlock your phone in the morning to reset your alarm, those are things that you can capture. So you can start building this really interesting texture of how to behave in the real world, and then predicting which days they're symptomatic, what if you know they're at risk of a certain condition. And so the system's training with millions of samples about you as an individual, obviously with your permission, understanding that, and then allows us to deliver the right support at the right time. So for some people, it might be support that's in the app itself. It might be coaching or support or messaging in the app that actually sort of helps you work on specific skills or helps you get better. For some people, it might be a connection with their healthcare provider or their healthcare system. So it may be a nurse or maybe somebody else in the ecosystem who actually calls you and talks to you about what's going on. So, but what this allows us is at scale, you can essentially now support a much larger population of people. You can deliver access to a much larger group of people. And then our goal in all of this, obviously, is to continue to demonstrate outcomes that show that these people are actually getting better or getting the support they need.
Now, Doctor, is this still primarily in the pilot stage across the country, or is it now in the commercial market?
It's in the commercial market. We are now at about, I want to say, 30 or 40 different healthcare systems across the country. Obviously, we're still a startup, so there's a lot of scaling that's happening. But it's been a busy, year and a half for us. Yeah.
So what is the business model? If I'm a health plan and I want to utilize, this solution, if I'm an employer, what is the business model for them?
Yeah, so for a health plan or an employer, the business model is really simple. So the idea is you work with Ginger.io, we're your digital mental health solution, and in exchange for people getting better in your population, you essentially pay Ginger.io. So it doesn't require any sort of integration or support or any other work on your end. We actually have patients coming on our system directly, and so we manage everything from the onboarding piece to making sure they get the right support, delivering all the in-app interventions and all the other pieces. So all of that's part of our package that we will work with payers and employers on.
Is it a per employee or per member per month pricing model, or how what is
we're flexible in that. So I think there's per member per month is the traditional way that seems to be the way the payers typically like to work. I do think there's a movement happening where it's PEPM, so per engaged user per month, and so that really is about demonstrating outcomes at an individual level. So we're certainly open to both kinds of pricing, and we can work with either model, whatever's the right fit for the employer or for the payer.
So what are some of the early lessons and takeaways that you've learned in working with, the payers, providers, and patients to date?
I think the biggest lesson is patients are looking for a solution. Consumers are looking for a solution. And what's happened in our generation is is really there aren't that many patients, right? They're consumers. And so, when we need help with anything, we go online, we type it in on WebMD or whatever, and we start looking proactively for that answer. And I think what payers and employers need to realize, if they haven't already, that their members are doing this right now. It's happening. Mm-hmm. And those members are going to sign up for tools like Ginger.io, or they're going to sign up for other tools on their own and essentially start getting support. And I think there's a real opportunity here to actually be a forward-thinking payer, and many employers are doing this already, and actually support and make that happen. And I'll give you a specific example, right? So at Ginger.io alone, we've screened about 800,000 people with anxiety and depression. Right, so this is, 750,000 people who came to Ginger.io and were interested in looking for a solution. And these aren't people who came because their employer told them they should do that. These aren't people who came because their payer told them to do that. But they all have employers. They all have payers. And I think it benefits, for anybody who's thinking about the future at a payer, really should be thinking about how to take advantage of that consumer energy, the desire that people have to get better, to have a great experience, that their families have to look for a solution, and really channel it into the combination of the right payer/digital tool, that sort of combined formula, and what does that look like. And those are exactly the kinds of conversations we're having with peers right now. And so I think that the fundamentals, I would say the headline is consumers want solutions. They're seeking them out. They're not waiting for their peers or their providers to give them to them anymore.
Question, there's a stigma associated with mental health and getting care for that. How does your solution address that or overcome that?
Yeah, I think so. There's different parts to that problem, right? So there is a societal stigma, and I think that's a much deeper piece. And no single app, no single product is going to solve that on its own. And that's, I think that's changing in our times. I think we're talking more openly about it. When celebrities go through depression, there's more open communication around it. We see a lot of talk about how schools and universities are now addressing it head on. So I think that's a societal change that's already occurring. And actually that's related to an access issue, because the more aware people are, the more likely they're going to need help, and our systems need to be up to speed to actually deliver that care. And then there is the experience. So that's one part. But then there's at a more tactical level, there's the experience that people have when they use our product, right? And I think this is where design and user experience, are really, really important, right? And nobody wants to install an app on their phone that says this is your schizophrenia or bipolar app, right? But everybody wants to install an app on their phone that actually makes them feel better, that actually makes them, it helps them manage the things that they know they're struggling with. And so I think the tone, the language, the way you communicate with consumers, the way you design those products, I think the bar is essentially the bar for any other consumer app. And a lot of healthcare apps just happen to be in healthcare, where the bar is still that high. And so it comes down to how you design it, the experience from day one, how easy it is to use. All those things are really, really critical. And I think, there are people out there looking for, anxiety is a way that people often talk about this. Depression, obviously, is a way that people often talk about it. And so being part of that conversation on the, online in the real world, I think is really also important for our product to be successful.
Well, it's I love what you're doing. I think it's badly needed, and we wish you great success, and we look forward to helping you gain that success. Before we sign off on our conversation, would you just share with our listeners maybe 2 or 3 takeaways you want to make sure they capture?
Yeah. So number one is digital mental health is here. It's the way that we, as a society, are going to solve the access problem. It's a way we're going to create a user experience that people actually want. And it's a way that we're going to manage costs in the healthcare system. And whether that is at the system level or at the individual level, cost is a huge factor as well, obviously. I think it's important for digital mental health companies to really be based on outcomes. And that's something that we've been built around from day one. And so I think that's really, really critical. And I think it's actually a very exciting future, even in the short term. And it's exciting because people are looking for solutions, and we're at a point now where technologies are sort of, really seeing a lot of, like we ourselves are seeing a lot of consumer demand, for example. And, would love to sort of work with peers, work with employers, and really make this part of a system-wide change. So, yeah, those will be my 3 takeaways for the audience.
Well, great. Thank you so much for joining us. We look forward to talking with you again soon.
Excellent. Thank you. Thank you for having me.